Premier, go ahead.
Thank you. Well, thank you, Heather. And thank you for all those who are joining. And hello to all Islanders joined in on Facebook Live. Um, as we all know, these are new days. Islanders are dealing with many new and immediate realities of this rapidly changing life we're living. And the fact that we are brought together today, largely through video conference, is just yet another example of these unprecedented times. From the very beginning, we have been dealing with these difficult times on two fronts. First and foremost, from the health perspective, our joint health response team, led by Chief Public Health Officer Dr. Heather Morrison and her staff, along with the Department of Health and Wellness and Health PEI, have been providing exceptional leadership and putting in place the best possible health measures to help us contain and mitigate the spread of COVID-19 in our province. We are in a state of public health emergency. We are taking unprecedented steps like those that were announced earlier today to do everything we can to limit the spread. These decisions are not reached easily, and we recognize the impact they have on the lives of each and every Islander. That should give you a full understanding of just how serious this situation is, how serious we are taking it, and how much cooperation we need from all Islanders to assist in the best possible process to limit the spread of COVID-19. Along with the very serious health implications, we know that COVID-19 is having and will continue to have a devastating impact on the economic and social well-being of Islanders. We are working hard to address those immediate concerns through measures we announced yesterday and measures that we will announce today, and we will continue to make announcements in the days ahead. Today, we'll be announcing some further economic rollouts designed to put money into the pockets of Islanders as soon as possible. Those Islanders who have been unfairly, through no fault of their own, been impacted by COVID-19. As well, we will provide further information on issues pertaining to our efforts to respond to the provision of childcare for essential workers, assistance for those in the childcare or early childhood education who have been impacted, as well as the status of essential government operations. Before I ask my fellow ministers to bring their announcements, let me say that we are very pleased to learn of the Prime Minister's announcement today. Our staff, our senior staff in finance, economic growth, and executive council are now working with federal officials to fully determine what this means directly for Prince Edward Island. We believe it to be somewhere in the vicinity of $110 million. Most of which is designed to get into the hands of Islanders as fast as possible. I thank the Prime Minister as well as the four MPs in Prince Edward Island, particularly Minister Lawrence Macaulay, who have answered the call of Islanders and Canadians with this emergency package funding. I would also like to raise here today, as I did on the call today with Canadian Premiers and Deputy Prime Minister Freeland, my extreme disappointment with the decision by CBC to cancel Compass. At a time when it is critical for all Islanders to have an open communication with government, being in a state of public health emergency, we need to have the #1 watch supper time news program in the country to be broadcasting. I raised this issue with the Deputy Prime Minister. I'm awaiting to have a call with the Prime Minister of Canada because we need this decision to be immediately reversed. We are in a very challenging time. Ongoing communication with Islanders is paramount, and making sure Islanders have the most up-to-date information will be crucial in getting us through this. And we need our only provincial television news to be online at 6 p.m. every evening to assist with that. Finally, I will continue to add my voice to those who are trying so hard to impress upon Islanders the seriousness of COVID-19 and how important it is for each and every one of you to heed the important information from our Chief Public Health Officer. I know it is tough. I'm living through it here at home, so I share your concern and I share your frustration. But we are in unprecedented times, a difficult time, and that requires each and every one of us to meet those challenges head on with our very best island effort. We will get through this, and our journey through this will be a little bit easier and hopefully faster if every Islander acts accordingly. So thank you, and with that, I will turn it back to Dr. Morrison.
Thank you, Premier. And I think you said it very well. We're doing this to try to protect islanders, and we're trying to limit the impact that COVID-19 is anticipated to have on Prince Edward Island and in this country. It's not the first time we've had to do so, but I think it's important to have some clarification around what we mean by essential services. And we've talked about it during the week in various ways, but it's raised a number of questions, and I think it's important to the province to clarify. Behind the move to essential services in government and in business, and really asking islanders only to go somewhere if they feel like it's essential, it's about the social distancing. It's about how we practice that and how we refrain from congregating where we can come in close contact with each other. It's about trying to make sure that we don't get COVID-19 ourselves, spread it to family, and particularly, we do not want to hurt the most vulnerable people in this province. What we know about the virus is certainly changing as we go, but we know the virus lives on surfaces for hours to days. In terms of clarifying what's essential and non-essential, I have already indicated that grocery stores, pharmacies, gas stations are essential as people need access to food and medications. Hardware stores are also essential. Islanders need access to emergency supplies. If your basement floods, you need to be able to access something to help batteries, those kind of things. PEI automobile dealers with auto repair services and independent repair services and maintenance may remain open for the purposes of maintenance and repair. And based on what's happened in the last 3 hours, we need to discuss liquor stores. It is only government-owned and operated liquor stores that are closing tomorrow at 2 o'clock. Agency stores are licensed to sell liquor, such as in convenience stores and breweries, will remain open. There is, I have to say, I'm disappointed in Islanders' response in the last 3 hours. We have talked about social distancing. We have talked about the importance of staying at home unless it's essential. And that appears to have been ignored in the last 3 hours. And perhaps, we underestimated that alcohol is considered essential for some people, but that's why it's important to clarify what the agency stores and the breweries are remaining open. And the goal of closing the liquor-controlled or the government-run liquor stores was for the safety of the staff at those stores, and also for Islanders to limit the risk of close social interactions and reduce the virus transmission. But based on what's happened, government is working on alternative options so that Islanders can try to access these products in other ways without coming into close contact with each other. And further details will be available likely by tomorrow. So it's important for essential businesses and services to practice safe social distancing and good hand hygiene practices and the messages we have been given. If Islanders are feeling unwell, they should stay home. If you're supposed to be in self-isolation, stay in self-isolation. And I'm encouraging all Islanders to stay at home unless you need to go out. Only one person from the household, for instance, might be able to go out and get groceries or supplies from essential businesses and maybe not take the whole family. these clarifications are important. We'll continue to have clarifications. This is new, as the Premier mentioned, for all of us. We may not get it all right. We'll try to do the best we can as we go through a very difficult time, knowing that the public health measures that we're putting in place now do have those unintended impacts for all of our society. But we are coming together by being apart, and I said that yesterday, and but the goal is to try to minimize the impact of COVID-19 in this province. So I think I'll leave it at that, and I'll turn it over to you, Minister.
Well, thank you very much, Dr. Morrison. So childcare centres play a critical role to support our families, and of course, their operation in the future is also critical. So while all childcare centres across the island are closed right now in their efforts to limit the spread of COVID-19, we want to ensure that we are supporting licensed operators by making sure that all childcare spaces will be maintained, staff will be eligible for employment insurance benefits, and operational grants and subsidies will continue to licensed operators of childcare centres. So, as a result of the impacts of COVID-19 response, we will continue to work with and support early childhood care centres and parents and address concerns on an ongoing basis. Now, also as a part of the COVID-19 response, we're requiring essential workers to go to work. For example, healthcare workers. They will need childcare. We are asking them to fill out an online form detailing their childcare needs. We will use this information to provide appropriate childcare for them. We will share the necessary information directly with those deemed essential workers so they can respond with their childcare needs and we can fill them. And I'll turn this over to Minister McKay.
Thank you, Mr. Trivers, and good evening, everyone. I would like to start by providing an update on the two programs we announced yesterday. Both the Emergency Income Relief Fund for self-employed islanders and the Emergency Working Capital Financing for small businesses are now ready to accept applications from impacted islanders. Details on the programs and how to apply can be now found on our provincial website. I believe most are aware by now that we have a 1-866 number for island businesses to call and share their concerns on how COVID-19 has impacted their business. The phone number is 1-866-222-1751. Once again, 1-866-222-1751. And now, as of today, we also have an email address that island businesses can also use to share their concerns on how COVID-19 has impacted their business. The email address is peibusinesshelpline@gov.pe.ca. Once again, peibusinesshelpline@gov.pe.ca. The function of this email address acts the same as the phone line, allowing staff to collect contact information from businesses and hear their concerns on how their businesses have been impacted. The overall goal of both the phone line and email address is to hear how island businesses are being impacted, to collect their contact information and use the information we receive to help develop more programs from the $25 million emergency contingency fund announced on Monday. Every day, island businesses are having to make tough decisions. Our department is continuing to respond quickly to their needs. So today, we have decided to defer all scheduled loan payments for clients of Finance PEI, Island Investment Development, Inc., and the PEI Century Fund for the next 3 months. This is one way we can help take some financial pressure off businesses during this very challenging time. Earlier today, the federal government announced some supports to help Canadian workers and the self-employed impacted by COVID-19. We thank the federal government for responding so quickly to needs of Canadians across this country. We want to assure all islanders that no one will be left behind. We continue to work with our federal government counterparts to make sure all workers and self-employed islanders have the supports they need to get through this crisis. If there are any gaps in federal supports, if some islanders realize they don't qualify for federal supports, we will address these gaps through our own provincial funds. We will make more detail on what our provincial supports look like as we learn more about details what the federal government will roll out. We know that this pandemic has been incredibly challenging for our island workers. We hear your concerns and we're here to support you. We know we don't have time to waste. Islanders need money in their pockets now. So today, we're announcing a $200 a week allowance for anyone who is still working but has experienced a significant drop in their hours of work. This will be a temporary allowance. We are working quickly to figure out the details on how this will be delivered to islanders. I will have more of an update on this for you tomorrow. I want to thank all islanders for your patience as we continue to roll out our supports. I also need to thank government employees who are working hard behind the scenes to roll out these programs. I promise islanders we will continue to listen to your concerns. We know these are tough times, but you have our support, and we will get through this together. Thank you.
BC?
If I could direct this question to Premier King, I understand the first priority obviously is around making sure that people get the financial aid they need. Do you have any sense yet what this is going to end up costing the province? And furthermore on that front, how much of this will be offset by the federal government's $110 million? I assume that $110 million is specific to PEI.
Yeah, thank you, Wayne, for that question. We have earmarked $25 million to begin, which we have been calling an initial offering. We expect that'll probably be more. Through the next few days, we will figure out what the federal program is going to cover, where we need to top up or add to. We certainly don't want to duplicate the service of that. Our priority from the very beginning has been to do what we need to do to get islanders through this. If it takes more than $25 million, we're prepared to spend that to get through this. I've been talking a lot about the immediate economic shock and also the economic recovery that comes beyond that. So we need to make sure our island is positioned well. We don't need businesses closed permanently because of this. So that's why some of the programs that Minister McKay has been talking about the last couple of days are designed to help employees, but also to help businesses and the self-employed, because we want to have something at the end when we do get through this. So we've determined whatever we need to spend, we're prepared to spend it, and we just don't know what that is as of yet.
Okay, thank you.
Stoonie B, The Guardian.
Sure. Hi, everyone. Yeah, so I guess my question is just about capacity of the provincial government to carry out these programs. I mean, if it's in terms of if most provincial staff are basically being ordered to work from home, is there a plan in place to sort of scale up, I guess, the mechanism of the provincial government to be able to deliver these programs to businesses and workers?
Well, Minister McKay can probably tell them what's going on there in terms of the work from home plans.
Certainly. So over the last couple of days, we've been developing web criteria and applications on both sides of it, which is going to allow islanders to access them forms at home. We have our innovation department working hard right now, and on the next program we're running out with the $200 a week. We believe we're going to minister through that through the skills department as well. So I do find once we're set up, it's going to take a couple days to get it right, but once we get set up, I think things should run relatively smooth. So we do have supports behind the scenes. That's why I want to thank them. They're behind putting all these programs in place right now, and they were on the phones last night till 8 o'clock, and I really want to take the time to thank them, but I think we're going to get through this all right.
Sean McDougall from the Eastern Graphic.
Yeah, I just had one question on behalf of our other publication, the West Prince Graphic. With regards to the Western Hospital Emergency Center, is there anything being done about the closure of the emergency center due to a lack of nurses?
So a question about, it was difficult to hear, a little bit difficult to hear, but about the potential closure of the Western Hospital from a shortage of staff. So I know one of the things that's been happening at Health PIs is that they've put a call out for perhaps recently retired nurses and physicians. And I had a brief conversation with Health PI today regarding the same, and we probably will have some numbers and some extra staff to be able to respond to that kind of situation, and details may be available even as soon as tomorrow about the number of additional people that may be able to come in and help, not just there, but right across the system, as we have some staff still on self-isolation because they have returned from travel outside the country.
And just a quick follow-up to that, is the lack of nurse coverage because there's nurses that are self-isolating, or is there other reasons?
I don't have any specifics about that site, but the staff issue, as far as I am aware, across the province is, and it impacts certain sites perhaps a little more than others, that they have been, are returning or recently returned from travel outside the country and are self-isolating as we've requested for a period of 14 days.
Laurent Rigaud avec la Voix acadienne.
Yes, I have a question for Dr. Morrison. I just wanted to know if you received the test results you were waiting for earlier today.
Thank you. So I received an email from the laboratory at the National Microbiology Lab, and they said the results will be available for me today and likely by end of day in Winnipeg time. So I anticipate those results will be in sometime later this evening.
Opening it up to additional questions from reporters on the line.
Julien Lecacheur, Radio-Canada. En français, 2 questions. Une première pour le docteur Morrison. Docteur, je voudrais savoir, depuis votre annonce sur la fermeture des magasins d'alcool, les gens se ruent dans les magasins, les gens sont collés les uns aux autres, il n'y a pas 2 mètres de distance. Est-ce que vous estimez que vous avez fait une erreur en laissant jusqu'à demain pour laisser ces magasins ouverts? Pensez-vous que vous auriez dû les fermer plus tôt, et qu'est-ce que vous avez à dire sur l'attitude des insulaires en français par rapport à ces magasins d'alcool?
En premier, je suis un peu déçue que les insulaires n'ont pas vraiment écouté qu'il ne faut pas sortir sans que c'est pas essentiel, et puis il faut maintenir une distance de 2 mètres entre les gens. Alors je suis déçue qu'ils n'ont pas écouté, parce qu'ils mettent eux-mêmes en danger, mais eux-mêmes avec un risque de Covid-19, et ils mettent vraiment les autres les plus âgés, pour l'instant aussi, ils ont un risque. Alors, je pense que on a dit c'est pas fermé dans 2 heures, on reste ouvert jusqu'à demain après-midi. C'est seulement les magasins d'alcool qui appartiennent du gouvernement. Alors, ils ont encore les magasins d'alcool dans les agences et les breweries. Alors, je pense que je suis un peu surpris à la réaction, et c'est pour cette raison que on vient maintenant pour clarifier. et puis que c'est pas qu'est-ce qu'on veut, on veut qu'on reste en distance. On fait une décision pour diminuer le risque aux personnes qui travaillent au magasin d'alcool et les gens la public. Alors, si il y a cette sorte de réaction, le gouvernement maintenant demande les questions. On peut avoir un accès d'une façon différente. Est-ce qu'on peut faire des choses pour que les gens peuvent chercher l'alcool et de commander d'une manière différente? Alors, je suis confident qu'on a fait une bonne décision parce que les magasins d'alcool sont pas plus importants que le gouvernement, qui est aussi, on dit que c'est essential services only, mais je suis quand même déçue d'une réaction qui met les gens eux-mêmes avec un risque et la public. Je sais qu'il y en a plein de sécurité là-bas maintenant, mais c'était tellement vite, c'était incroyable la réaction et c'est dommage parce qu'il met maintenant il met à risque la population un peu plus grande.
Merci. One question for Minister of Education, Brad Trivers. Minister Trivers, question for you. I heard for the past couple of days that many daycare, they are worried because they are trying to reach you about, what's next, how they will pay their employees. What do you have to say on that? And tell me more about, and give me more details about what you just announced for the employees from the daycare today.
Okay, thank you, Julien. So it's really, we're trying to respond on an ongoing basis, just like everyone is. And we do know that there have been concerns from daycare operators, whether they're a designated early years center or they're unlicensed. So on the unlicensed side, Minister McKay has made announcements. There's the Emergency Income Release Fund they talked about. He gave out the number again today, and we're asking those self-employed operators to go through that. For the licensed operators, that's what we're talking about today. Just to reiterate, we want to make sure that those child care spaces are maintained and that the staff they're eligible for EI so that they have the right income. And we're going to make sure that the centers themselves have their operational grants and subsidies continue. So we're hoping that addresses the majority of the concerns. We understand that, on an ongoing basis, parents and these early child care centers will have additional concerns. We have to realize that these are private entities. They're nonprofits, but they're not government run, even though, especially with the designated early years centers, we do provide a strong amount of support and grants and subsidies. So we can't just reach out and tell them to do things. We need to work with them. We need to ask them to do what's in the best interests of the parents and make sure we provide the supports that they need. So that's what we're going to do. Hopefully that answers your question.
Just a follow-up on this. Yesterday, Minister McKay said that you will give $500 per week to the self-employed. So you said to me, Minister Trivers, that it's for the unlicensed daycare. If the employees from the licensed daycare, they are asking for EI, they will receive less than the $500 per week who you are agreed to give to the self-employed person. What do you have to say on this?
So, we're really getting into the details here, but I think when it comes to the staff at the licensed, child care centers, we'll look at the EI they're eligible for, and if we need to top that up, we will. I think Minister McKay mentioned that as well, and he can feel free to jump in. But we have to work with that, and we have to work together with the centers, with the staff, with the parents to make sure we address these concerns on an ongoing basis. So as the Premier has said as well, I mean, things change, and this is a start, and we're going to work to address the concerns of people going forward.
Thank you.
It's Wayne Thibodeau here at CBC. I'd like to, and I know Dr. Morrison, you referenced this a bit in French, but can you clarify a bit on the essential services? So your message was very clear. Grocery, pharmacy, gas, hardware is essential. So does that mean any other business that doesn't fall into that category should have its doors closed now?
No, I think, and Wayne, I think it's important that, and this is why it's important to clarify it, and it's a good question. So, businesses that are part of the supply chain for food, for instance, Cavendish Farms, would be considered essential. They're part of that the food chain, if you will. We mentioned the automobile dealers who do repairing and maintenance. Those would be essential. We have, we talked about hardware stores where you can need to get supplies that you may need. And so it's really the non-essential businesses that we're asking to close, and there's a reason behind it. And the reason is for social distancing. It's to minimize the risk of spreading the illness to others, and also getting the illness and then spreading it to those most vulnerable. These are decisions, as the Premier mentioned, that are made knowing that they have huge impact for us as individuals, families, communities, and business and government. But if we do it now, it hopefully will be shorter than it would be if we didn't. It will have less impact on the health of our islanders. So it's trying to use some common sense too, and of what would be considered essential, and asking the questions. It's a risk assessment in some ways, what's needed, what isn't, and what can you do that will be able to be conducted in a way that won't harm or put at risk other people. And someone actually, they wanted me to clarify as well that restaurants that can do pickup, delivery, drive-through, and I want to clarify that as well.
And can you just clarify, you mentioned you may be getting results back later tonight, so how do we get those results? Will there be another news conference this evening? Will we check the website? Will you just wait till tomorrow to update us on those numbers, if you do get them this evening?
Well, I mean, I think I can only do, I've been here twice for a press conference. I don't know if I can come back. But so, I mean, the majority of the results, well, I'm hopeful that all of the results are negative. And if I get a call about a positive result, of course, the first call I have to contact the person, the case as well, and we want to start initiating the contact tracing. So I think, Wayne, tomorrow will be an update with those numbers, and the numbers on the website will be updated at that time. And that is an important part of the process, but you'll and the results may not come in until 10 o'clock tonight, so it doesn't make sense to come back for the press at that time.
Understand. I have one last question for the Premier, if I can. Premier King, we've seen Ontario and now British Columbia issue a state of emergency, which I know is a much different scenario than our public health emergency that we have now. Has that been discussed, and if so, where are we in that discussion?
Well, thanks for that question, Wayne. And I think what we've been trying to clarify over the past couple of days, due to past incidences such as SARS and H1N1, there is now more teeth in the act that we are using now, where we're in a state of public health emergency. So a lot of the things that Dr. Morrison is able to do under this state of health emergency, other provinces have had to do because that is where their legislation takes them on a full state of provincial emergency. We've had discussions about that. I mean, that's a discussion that's held between Dr. Morrison, emergency measures officials, and would eventually be a request that would be made to the Minister of Justice and Public Safety. We're not there yet, but a lot of credit goes to previous governments who have taken the advice of bureaucrats, healthcare professionals, after we had gone through similar issues such as SARS and H1N1. We now have more teeth into this part of the Act, which allows us to do much of the stuff we would have had to do by declaring a state of provincial emergency.
Thank you very much.
Question for the Premier. This is Stu Nieper from The Guardian. You earlier put out a statement about the cancellation of the Compass program and said that you were going to try and reach out to the Heritage Minister. You've spoken to Deputy Prime Minister Freeland. Just wondering if you made any headway with those discussions or if you've further reached out to the management of CBC on that.
Well, we're working through that, and we're hopefully going to connect with the Prime Minister later this evening, just working with my officials, with his officials to do that. Through the bringing the conversation to Deputy Prime Minister Freeland. I'm aware now that the Minister of Canadian Heritage has been made aware of the decision and has been talking with some officials at CBC and his department to see if anything that can be done. CBC, of course, is a Crown corporation, as the Deputy Prime Minister pointed out, but I did reiterate that several $100 million of Canadian taxpayers' money is put into that. So I would hope that would give us a certain say. And the reason I would ask for an intervention, CBC North is continuing to operate simply because they're the only provincial entity in the North. And I think it's the same reason here in Prince Edward Island. We only have one provincial TV carrier that is here every day, and that is CBC, and that is why I'm bringing this forward. I know it's rather ironic to some of my premiers across the country that I would be lobbying to keep CBC on the air, but I do know how important it is to Prince Edward Island every day, and in particular in a time of public health emergency, we need it here. So we're working and doing everything we can to bring some common sense to this issue, and hopefully have this decision reversed as soon as possible.
Okay, last thing as a follow-up for me, just a question for Dr. Morrison, I believe. I guess you'd sort of alluded that there might be alternative methods that Islanders might be able to access, I guess, alcohol or cannabis supplies. Can you talk a little bit about that? I mean, would this be a sort of online sales situation, sort of like, I guess, what other provinces have talked about implementing?
So I think early discussions today about in access, and it might be online, it might be drive up to the liquor store. I think those are being explored in conversations with their respective bodies, and I think that will help maintain the social distancing, keep people to have access that they need, in addition to the agency and the breweries.
Okay, thanks everyone.